Weight bias case study, Louis Ballenger. Mr. Ballenger is a 39-year-old male. He is allergic to adhesive tape. His diagnosis is lower extremity ulcers, lymphedema, arthropathy, and morbid obesity. His current weight is 76 pounds. He is 70 inches tall. His BMI is 54. Ideal body weight is 166 pounds, and he is 229.5% of his ideal body weight. Glucose labs are elevated. Creatinine is low. CO2 is high. Monocytes are high, and these labs are indicative of infection at this time. He is admitted with non-resolving bilateral lower extremity lymphedema with lower extremity ulceration. Edema is more predominant on the left side than the right leg. The patient denies fever, nausea, vomiting, or diarrhea at this time. Prior medical history is morbid obesity, hypertension, chronic lymphedema of lower extremities for the past approximately 3 years that is unresponsive to CDT therapies. The actual cause of his lymphedema is not known at this time. It is believed that he had contracted a lymphatic filarious infection as a child when he traveled with his family to the Dominican Republic. He has a history of hypertension, hyperlipidemia, spastic colon, bilateral knee arthritis, recurrent cellulitis of lower extremities, and status post cholecystectomy, meaning his gallbladder was removed. Patient lives at home with his 3 cats. He is a former smoker, quit smoking about 5 years ago, no recreational drugs. His mother passed away at the age of 38 from heart problems, and his father died at 68 years old from leukemia. His uncle, who is still alive, has a recent diagnosis of leukemia as well. Patient is the only child. Patient is on a low-fat, low-cholesterol diet. Patient is on lisinopril at this time for treatment of hypertension. Patient is on Simvastatin for lowering his cholesterol and triglyceride levels in the blood. Patient is also on esomeprazole, which is a proton pump inhibitor used to treat stomach conditions such as acid in the stomach, and naproxen for pain, inflammation, and swelling. Patient needs, estimated energy needs are approximately 2,100 calories per day. It is recommended to decrease total calories by 500 per day if the patient wants to lose weight. So if the patient did want to lose weight, then we would reduce his total kcal by 500 calories per day. There was weight bias present in the attending physician, Dr. Chamberlain's H&P. With the statement, the patient is an obese male. This is a biased statement. Dr. Chamberlain also said that the cause of lymphedema is unknown at this time, but definitely exacerbated by the patient's obesity status at this point, which is also a biased statement. As a nutrition professional, I would talk to the doctor and ask him to maybe rephrase his statements. Instead of calling the patient an obese male, the doctor could say something like, the patient is 39 years old with a history of morbid obesity. Or the doctor could also not 100% attribute the exacerbation of the patient's lymphedema due to his obesity. Motivational interviewing tactics I would use for the patient would be I would like to explore the patient's ambivalence as far as, is there anything preventing this patient from changing his diet or losing weight? I would use the self-determination theory. just to see where the patient is at this point and discuss potential risk and complications of his obesity status related to the lymphedema. I would ask permission of the patient if he did want to lose weight, and then if he did, then I would be able to provide resources and education to help the patient lose weight.